Hi everybody, welcome to my Facebook Live today. So today I'm going to talk about this handout. It's called the Osteoarthritis, get away from my face here, checklist, and it's from the Zoetis Corporation. A couple weeks ago I did do a presentation about the pain, anxiety, aggression, connection, how pain, chronic pain, especially that low-grade smoldering pain, can increase the behavior signs of anxiety and aggression. And there's a broader understanding of this as we're, continuing to know more about the progression of, say, osteoarthritis and arthritis, the changes that are going on internally, biochemically, and then also how those affect behavior. And behavior, remember, is more than feelings. It is primarily about feelings, but it is also about the movement of the body. So drop in appetite, decreased play, decreased coming up to greet you. These are all behaviors. So it's always been kind of hard to find a way to quickly ask clients and get that input, get that history on small changes that the dog is doing. Today we're going to talk just about dogs. But anyway, small changes in what the dog is doing to get a handle on this, low level of chronic pain. So Zoetis came up with this nice little infographic. Infographics are always nice because you have the pictures and it's easy for people to see than the picture. And just a quick little check mark is all the client has to do. It's two-sided, so it's on one page. You can go to the Zoetis website, and that is the zoetis.com/OA-pain. And then /canine, and you'll see the handout. So what's on this handout is, you can print this off. You could also send this to your client, email it, text the PDF to the client, where then they could fill it out and then send it back to you. But of course, it's going to ask for the pet's name and the client's name. But some of the questions that are on here is limping after exercise, lagging behind on walk, so it has a nice picture of the little dog just kind of walking behind instead of walking forward. Most of our dogs are not that good at heeling, so they tend to want to go ahead of us because they're excited about sniffing and walking. And so now as the dog gets older, they may actually be walking more slowly, and they're lagging behind, or maybe lagging behind after the first 5 minutes of the walk because now it's starting to get a little sore, a little, gimpy for them. Slow to rise. This is a really common sign that the dog is slower to go from laying down to getting up. They kind of do that and get up. Okay, so what used to be just they jumped right up, now they're taking a slower time to rise. So that can be an indication of inflammation. I have my little stuffed dog here. Inflammation in the lower lumbar spine as well as in the hip area, or even in the hock area, because it's the combination of all those muscles that are required to have the dog get up. Difficulty jumping. So if the dog used to be able to just jump right into the back of the SUV, the back of the sedan, and now they're doing that stopping and thinking. You can see them, they just sit there and they think, look. Okay, that one would check this off because that's slower to jump in or difficulty jumping into the car. Feeling stiff, that's where if you really watch them, they're walking with a little bit of a stiff gait. And difficulty with stairs. So the difficulty with stairs is, again, they'll sit there at the bottom of the stairs, kind of look up, and then because they're figuring out, how am I going to get up there, kind of getting themselves geared up. So that's stopping and thinking before they go up the stairs. That's what difficulty with stairs is. Now, two simple questions at the bottom. Do you think your dog shows signs of pain? Yes or no? Now, this may surprise you, but I've had clients that have indicated yes to 4 out of these 6 signs, and then when asked, do you think they have pain, they'd say no. They didn't realize or think that being slow to get up or walking stiffly or difficulty jumping in the car would be any kind of a sign of pain. And then the second question is, have you noticed any changes in your dog's behavior? And now more clients would tend to say yes to that. Well, yeah, he doesn't want to play as much. He doesn't want to fetch the ball. He doesn't play with his toys. He doesn't want to play the tug of war. He just or he drops it, or he quits earlier. So they would say yes to changes in behavior while they were saying no to pain. And you know what? Frankly, that's okay. Because that's my job, that's the job of the veterinary staff, things like these handouts, to help clients to understand that how pain presents in an animal may not be what they expect. They aren't going to be crying in pain. They aren't going to be holding that leg up or holding that head down constantly when they're in a low level of pain. And so if they say no, you know, that's all right. That's the level of what a client understands right then, and it's important for me to know that. Now on the back side here, you know, there's a little explanation here about how, you know, behavior and pain are related, and that, you know, it says in a recent study, dogs showed significant improvement in both their emotional and physical well-being with the pain under control. So yes, Dr. Daniel Scott, he's a board-certified veterinary behaviorist, has provided some, you know, studies and documentation of how dogs are more sensitive to noise when they're in pain, and this evidence is growing. So that's what that's referring to. So again, another little like scale questionnaire here, only 4 questions, so it's short, it's easy to do. Asking, is your dog energetic, enthusiastic? And the range could be like, my dog couldn't be less energetic, all the way up to couldn't be more. So you just, you know, are going to circle the number that indicates energy, happy and contentedness, active and comfortable, calm and relaxed. And then this will give us an idea of, you know, where on the scale the pet is. I would say I don't see a reference to an actual scale, like, you know, what's considered good, what's considered not so good. I would have to say if your dog is averaging around a 3 to 4, that's really very good. Of course, a 6 is excellent. But if we're down here at the 1, but, you know, 2 and below, now we're going to want to address pain in addition to the behavior. Now it says, you know, sharing additional history can help your veterinary team help your dog. So the first one is, has your dog ever been injured? And, you know, people may change veterinarians over time, you know, with the life of their pet. They may change practices, or even within some of these practices, there are 10 veterinarians working. So you may not always see the same veterinarian on one checkup 1 year and then coming in, say, for checking a skin problem or something else on the next visit. So making sure that we are aware and that it's on the medical record that, say, maybe this pet was hit by a car in the past, or was slammed in the head, you know, with a softball, or kicked by a horse. Now, I'll have to say this. A lot of our rescue dogs have had some kind of injury, and we don't even know about it. They may have been hit by a car. They may have been shot with a BB, and that history wasn't told to the rescue the dog came into, or it was, but it didn't trickle down after the adoption. You know, it was like, oh, he was hit, but he's fine now, everything's okay. And that doesn't, you know, get told to us, the veterinarian, so that then when the dog is 5 years old and they're starting to show these signs of limping and stiffness and difficulty jumping, we may think, wow, that's kind of odd, he's pretty young. But it was because of this past injury, but nobody knew about it. So I'm going to say this. When you have a rescue animal, and especially if they're over the age of 3, and they're showing any kind of stiffness, reluctance to jump, you know, and it may look like anxiety, still think about pain, because a lot of these dogs have had some kind of trauma to their body. Second question is, have you ever given your dog medication for pain, such as aspirin? And it's a yes/no question. And there's a lot of clients who are still giving aspirin to their dogs. They may be using the coated aspirin and just periodically. And we need to know that, because if you are reaching for an over-the-counter product, yes, it may not be safe and good and what's the best for your dog. And of course, we want to avoid that. But secondly, if you're reaching for a product, it's because you feel your pet needs it. They're showing enough symptom, and I need to know that so that way I can address it and give you what's safest and best for your pet, plus to help you know how to help your dog have less problems with this to live a longer and healthier life. And the last question, of course, is if your pet has gained weight in the past year. And while weight gain can be from overfeeding our pets, quite honestly, a lot more of the weight gain does come from the pet is less active. They aren't playing as much. they're maybe starting to lag on the walks, and now because they're lagging, the owner's like, oh boy, okay, let's just make the walk 5 minutes instead of 10. And that difference just in 5 minutes with each walk will decrease muscle tone and decrease metabolism such that they are going to gain weight. Now, any pet owner can download this handout and use it to bring to their veterinarian themselves. You can go to the same website, the Zoetis.com, OA-pain canine. Any practice can download this and use it within your practice. You can share it on your Facebook page, you can put it on your website, you can have it to literally hand out to your clients, or again, like to email it. Now, the website, I pulled it up here, it's a little old-fashioned, I'm going to show it this way, my laptop. This website from Zoetis it's really complete without being too overwhelming with tons of, scientific types of articles. And it gives some different articles for the client level that you could put in a newsletter, you could put on a Facebook post, you could share in different ways to your clients about, is your dog limping, lagging behind? And there's also a link to the Canine Arthritis Management Group. I really like this group. I have joined it on Facebook. They have a bunch of YouTube videos, and they're doing interviews with lots of different people in the veterinary health world. And that was where I saw a recent interview with Dr. Daniel Scott on the connection between pain and anxiety and arthritis. And so I suggest going to this website, use the resources, share it with your clients. Clients, you can go to this page, and you can go ahead and read about things and share it and bring it to your veterinarian. One of the best things I think about when we are considering and we address pain, when we have that middle-aged to older dog that is showing anxiety, aggression, or even compulsion, is that addressing pain, we can see results, we can see improvement really quickly. When we use the non-steroidal anti-inflammatories, we add in a joint supplement, some of our specific pain relief medications like gabapentin, tramadol, they can quickly decrease that pain within 2 to 3 days. And oftentimes, if pain is a part of the problem, you're going to see the behavior improve significantly within 3 to 5 days. And so whenever we're faced with a behavior issue, whether you're a veterinarian, if you're called into helping out, to do a behavior consult and you're not a veterinarian, if you have any dog over the age of 5, I strongly recommend you let the primary care veterinarian know that this client has contacted you, you are doing a behavioral assessment, and you share that with the primary care veterinarian. Because there may be pain going on there, and it really is best to do a trial of some of these pain relief medications and not only focus on our anxiety reducing medications, because the pain reducing medications, especially drugs like tramadol, do increase serotonin. And gabapentin facilitates how the serotonin gets in the brain, so you get the dual benefit. And so if we're only speaking in terms of behavior, we don't incorporate thoughts about the rest of the body, we're going to shortchange really a full assessment of this animal and the best plan for helping to improve both behavior and the physical health. So thank you very much. Oh, one last thing I also want to say when it comes to assessing pain or assessing arthritis. It's great to have this. And if I had somebody coming in my general practice for, routine, exam, annual vaccines, heartworm test, you name it, they fill this out and I say, ooh, you got 3 or 4 of these checked off here. Even though you don't think you're showing any pain, but you are noticing some changes in behavior, the best thing is to schedule either a telehealth consult or ask that client, would you take a video of your dog walking through your living room, walking through your kitchen? You say he's having a couple of, lagging behind on walks. Could you take a quick video on your cell phone of him on a walk and send that to me? A 2-minute, 1-minute video watching that dog walk through the home, going up and down the stairs, walking on a walk, that sort of stopping and thinking. It tells you so much. It is a visual assessment of that animal, their mobility, and their environment. When you look at some of these homes that are covered in hardwood flooring or the vinyl plank, flooring or ceramic flooring, and the dog's feet have a hard time getting traction, now you can advise the client for where and how to put some of the area rugs and things to give this dog traction, and that will help the dog to walk. And you would have never known that. You would have not have known that, or it might have taken a half an hour trying to do history taking, where this 1-minute video shows you all that, and then you can give the plan, and then you have the client do it and send you another video back, or do a quick telehealth consult again, and you can see the difference. So that's just a plug for using our technology to help make life better for everyone. Thank you very much. You can find, like I said, you can find this handout at Zoetis. I'm going to put this in my next newsletter from the Bella Behavior Foot and Friends website. If you'd like to sign up for my newsletter, you can do that at my website, drsallyjfoot.com. I do offer telehealth behavior consults, and I also do offer telehealth medical consults, one referred by a primary care veterinarian, and for pet owners, and that I can do the assessment for mobility as well as behavior and the environment. I hope you all have a really great Thanksgiving. Please wear your masks. We just have about a month or two to go before that vaccine is going to be out. It's going to really help to improve our world. And I just want to wish you all a happy Thanksgiving. Thank you.